Myasthenia gravis is a chronic autoimmune disorder that weakens skeletal muscles, impacting their ability to see, smile, walk, talk, eat, and breathe. The body's immune system attacks the connection between the nerves and the muscle, limiting the ability of the brain to control muscle movement. And diplopia and ptosis are common initial complaints. Symptoms are double vision, muscle weakness, facial weakness, difficulty swallowing, chewing, or smiling, slurred speech, falling and tiring easily, and shortness of breath. Harry was 17 years old when he first visited his doctor. His complaints were that he woke up feeling fine but throughout the day got really exhausted and weak. During a meal, his jaw muscles used to become tired, which interfered with chewing or swallowing and even talking. Repetitive movements like walking got tiresome for him, which also started to affect his posture and balance throughout the day. He and his doctor noticed that his eyelids started to droop a little bit and he had trouble focusing while reading and he developed blurred or double vision. Pathophysiology of myasthenia gravis, which is an autoimmune disease affecting skeletal muscle. Myasthenia gravis is a type 2 hypersensitivity disease where the body produces antibodies that most commonly target nicotinic acetylcholine receptors on the surface of muscle cells. The antibodies block the receptors, which means the signal to contract isn't received. Those antibodies also activate the complement pathway, which leads to muscle cell destruction. Myasthenia gravis preferentially affects young women or older men and commonly affects the extraocular muscles, leading to eyelid drooping or double vision, but it might affect any skeletal muscle. The diagnosis of myasthenia gravis can be done through a few different ways. The first one is through a physical examination. So a doctor just examines the patient how they are looking. They check if they see any facial weakness. They also particularly look at the eyes. In some cases, we have unilateral ptosis associated with myasthenia gravis. When you manually lift up the eye which is drooping, the brain sends a signal to the normal eye telling it to relax a bit, so the healthy eyelid starts to droop. This test is known as Curtin sign test and it's a key indicator of myasthenia gravis. An ice pack test can also be used to diagnose myasthenia gravis. You place an ice pack on the eye between 2 to 5 minutes, and in cases of drooping eyelids or ptosis with myasthenia gravis, the eye will basically open up and appear normal. The reason this works is because the enzyme ACH gets inhibited at low temperatures, so it can also be used as a temporary resolution of the drooping eyelid, and that helps doctors diagnose myasthenia gravis. Myasthenia gravis diagnostic tests include endophonium test, blood analysis, repetitive nerve stimulation, radiographic imaging, and pulmonary function testing. Doctor's neurological exam diagnosis of patient Harry. Harry was diagnosed with myasthenia gravis. His BP was on a higher side, bilateral ptosis was on left side. Diplopia, that is double vision, on primary position. No neck and limb weaknesses were found and his facial strength was normal. Eventually, Harry's symptoms worsened to the point where he had to drop out of the school, and over the few months, Harry and I had to work together to manage his symptoms. But he still struggled with them and was not able to work full time. So, as he was old enough now, Harry and I decided to go through with his surgery. So once you confirm the diagnosis of a patient with myasthenia gravis, of course, it's important to know about the different treatment methods that have been able to reduce mortality from myasthenia gravis. Doctors recommend bed rest, and then one type of medication is an acetylcholinesterase inhibitor like neostigmine or pyridostigmine. Medications such as corticosteroids, immunosuppressive drugs, plasmapheresis, and intravenous immunoglobulin is also used. Surgical treatment, thymectomy. Removing thymus affects the immune system in such a way that it helps with myasthenia gravis. Doctors sneak through the spaces between the ribs. The incisions themselves are so small that the pain involved is really minimal.
I had a surgery on Saturday and I was out of the hospital the next day, and then I went back to school on Friday. Thank you.
After the operation, like all the patients, Harry was put back on the same medications, which later neurologists asked to withdraw slowly based on the symptoms. Harry continued to work with his doctors to manage his symptoms and says,
"This experience has taught me to look at the small things that count. Now I feel that I have something to look forward to and I'm who I want to be."